A good afternoon to you. Welcome to UBC Lunchtime News. It is Saturday, 20th of November, 2021. And guess what? You only have a few days to end the month of November and enter into the Christmas mood. My name is Pricilla Nalwoga, introducing you into the current affairs of what's been happening in our top stories, starting with the health sector. And with the health sector, Peninsula has proven to slow down the devastating impacts of rheumatic heart disease in children. The Director, Heart Institute, Dr. John Omagino, disclosed the new scientific development at the launch of the GOAL study conducted by the Institute in the northern Ugandan region.
According to heart experts, over 40 million people, especially children, live with this disease, but hardly notice, hence accounting for over 300,000 deaths annually. According to the GOAL study by the Uganda Heart Institute, clinical trials show that early detection of rheumatic heart disease and treatment with penicillin can prevent it from progressing and causing more damage to the heart as opposed to valve repair or replacement in the final stages.
Study whereby it is proved and were proved for the first time world over that penicillin slows the devastating impacts of rheumatic heart disease in the children from the Ugandan population. These findings address unacquired heart disease.
Having a sore throat, joint pain, rheumatic fever, among others, are some of the initial signs of rheumatic heart disease. According to Dr. Jocelyn Rebembera, one will hardly notice if they have the rheumatic heart disease unless clinical trials are carried out.
By a fever, so the temperature is high, joint pains, which are migratory, right now at midday the child says my knee joint is paining. By 2 p.m. it's the ankle joint which is paining. Now unfortunately this febrile illness is often misdiagnosed as malaria, not knowing that it is acute rheumatic fever, and that would be an opportunity if a correct diagnosis is made.
According to Dr. Peter Lwabi, people should shun from poor health styles, which include poor eating habits, excessive consumption of alcohol, smoking, among others, and resort to exercise, which cardiologists say is the only way to keep the heart healthy.
People are eating more refined foods, a lot of sugar, a lot of saturated fat. People exercise less, and therefore they are prone to obesity. Smoking, which is a very bad habit, is known to affect the heart, the lungs, and cause cancers and many other problems. And then the excessive consumption of alcohol.
According to the Commission on Non-Communicable Diseases from the Ministry of Health, Dr. Charles Okia Oyo, policies should be put in place to implement these findings for consideration.
That administration of penicillin G can prevent or offers much more benefit in changing the progression of the disease. Then I think we can based on the recommendation, I'm yet to see the findings. If we are saying yes, let's take this now as a country, we adopt this as our policy, recommendation, it will be done.
Dr. Craig Sebo, one of the lead sponsors of this clinical trial, says they are determined to train medics to carry on this program to the rest of Uganda and other African countries.
Children, and how do we expand them to the 20 million children in Uganda and then the hundreds of millions of children in Africa? And I look forward to sharing our brief with the Ministry of Health to come up with a roadmap to give this disease the investment it deserves for pennies a month of penicillin and an inexpensive ultrasound machine that we know we can train many healthcare workers to use. So,
I am Mary Namkose for UBC News.
Well, thank you so much, our UBC reporter there. We now turn our attention to the civil society organizations who are demanding for accountability on money given to government entities over the campaign against corruption. In the accountability to be demanded, how COVID-19 funds allocated in fighting the COVID-19 to government agencies was used. This was communicated by the civil society organizations during a presser in Kampala as we await to commemorate the International Anti-Corruption Day on 9th October 2021.
It is alleged that Uganda loses billions of shillings through corruption by some officials. This was disclosed by some members of the civil society during the launch of activities leading to the International Anti-Corruption Day celebrated every 9th December.
These include select district integrity promotion forum meetings, community outreaches in partnership with the Inspectorate of Government to build consciousness on rights and responsibilities. We have an anti-corruption convention planned, televised citizen debates and parliament as well, social media campaigns and talk shows at regional, national levels calling upon citizens to demand for improved services from their elected and appointed leaders.
According to the civil society organizations, some leaders have failed to play their role in the fight against corruption.
We know that corruption compromises the quality of public services, including health care, education, public works, among others. We see that evidence exists of extensive grand corruption. We've seen grand and political corruption and impunity involving loss of colossal sums of taxpayers' money.
Civil society organizations want all citizens to demand for accountability, especially the money allocated to government institutions and ministries in fighting COVID-19.
The procurements that were done during the COVID-19 period left a lot to be desired. We see there were inflated prices, 100% payments before even services could be delivered, and later we saw services delivered that were so poor.
It is against this backdrop that Ugandans have been urged to join the fight against corruption.
The missing link is citizens to walk into the office of the Auditor General and say, I want to see the reports of audits that they have done, which in most cases actually confirms whether there has been misuse of funds or not. The Office of the Auditor General is a public institution.
The activities leading to the commemoration of the International Anti-Corruption Day have been launched by civil society organizations. The activities are to be held under the theme, Promoting Active Citizen Participation in Social Accountability. Natong Rebecca, Namamonde Deborah, UBC News.
Accountability does promote transparency. But away from that, the State Minister for Health in charge of general duties, Hanifa Kawoya, is worried about the increasing maternal mortality rate in the country. According to the Ministry of Health, about 15 to 16 pregnant mothers die while giving birth on a daily. Hanifa Kawoya appeals to stakeholders to come and partner with the health sector to fight this challenge.
The increasing maternal mortality rate in the country is worrying health experts in the country. Minister of State in charge of general duties, Hanifa Kawoya, says about 16 expectant mothers die every day while delivering. She encouraged stakeholders in the private sector to continue working with Ministry of Health to overcome this challenge. Minister Kawoya says over 68% of the population in Uganda access health care from the private sector, which she thinks will help to reduce the increasing maternal mortality rate.
Live birth, approximately 15 pregnant women in Uganda continue to die every day. This is very worrying. It's very worrying, especially that when you see at these high rates of the death ratio, which should arise from preventable causes that include septic, hemorrhage, hypertensive disorders, and unsafe abortions. I am happy when the country representative said that the projection is to show that in a few years to come, the issue of unsafe abortions will not be there.
Minister Kawoya made the remarks during the Mary Stops Uganda Partnership Day held at Golf Course Hotel in Kampala. Kawoya appealed to stakeholders to support government in mobilizing communities to go for vaccination against COVID-19 virus. She appealed to parents to take care of their children, especially girls, to avoid teenage pregnancies.
In the child pregnancy during this pandemic, organizing again, and it's a very concerning reporting that even you hear that some of our parents outside outcrying to open the schools. Yes, they want the students to go back to the schools, but some of us in common want to send our children back to the schools and give responsibility to the school management, because the time they have been with them, they have had it.
The country director, Mary Stops Uganda, Dr. Carol Sechimpi, says since they started 30 years ago, communities using family planning methods have reached 1.7 million.
What is today is ask of all share what Mary Stops is about, because we do work in so many places, in so many different ways. I have found through my engagement with several partners that people seem to have a bit of knowledge about Mary Stops, but not the entire picture. So I'm hoping that out of this engagement, we will have a clear understanding of what the Mary Stops operation is about. So I want to
Dr. Orala Charles from the Ministry of Health commended Mary Stops Uganda and other development partners in the health sector for the effort in fighting case of maternal mortality rate in the country.
Reports or review almost every week, and beginning from the beginning of January up to now, the information which we have that we lost about 689 mothers. Those are the ones who have died in the institutions. Actually, the week of the 42nd week, that's in November, on the 2nd, we lost 17 mothers, and we know which facilities where they were.
I'm Nafka Farida and Salongo Kasivante.
Regarding the health sector, we do have the Ministry for Health and Ugandan Nurses and Midwives Union, who are engaging the Ministry of Education and Sports to scrap comprehensive nursing training. The Permanent Secretary to the Ministry of Health, Dr. Diana Atwine, confirms the development, saying comprehensive nursing does not offer specialized training.
Comprehensive nursing and enrolled comprehensive nursing training programs were introduced in 1994 and 2003 respectively to create certificate and diploma cadres of nurses with competencies in general nursing, midwifery, public health, psychiatry and management. However, this might soon change as the Ministry of Health and Uganda Nurses and Midwives Union are engaging the Ministry of Education and Sports to scrap comprehensive nursing.
And call them just nursing schools, so that you just be there as a nurse or a midwife. There are two things which we need to find it very serious. Because my son cannot waste time in the school of comprehensive, and in his perception, he's reading and saying, I will be a compressor, I will be a comprehensive nurse. Here is midwife, here is a nurse. No. Because we cannot employ them anywhere as compressors. So we want it as a nurse, a midwife, a nurse, a midwife, full stop.
And I am glad even Nursing Council is here. Now, comprehensive nurses were initially thought that if they rotate all over the place, they will know everything, but they ended up being everywhere and they are not skilled at all. They are not skilled. And that's why we are saying we must go back to the basics. We must go back. We want highly skilled nurses. The nurses know how to do things.
The Permanent Secretary in the Ministry of Health, Dr. Diana Atwine, was receiving mama kits, personal protective gear and other medical devices donated to Uganda Nurses and Midwives Union by Direct Relief, an organization based in the United States of America. The mama kits and other medical devices will be distributed to various hospitals across the country. Adiana Kuti and Clement Wanjira.
Thank you so much, Ida and Clement, for that report. And still in regards to health, over 600 persons Friday evening gathered at Sister Maria Dungan Primary School in Kamocha for diabetes, blood pressure and weight coaching courtesy of the Lions Club Kampala. Diabetes is a lifestyle disease that can be prevented through early diagnosis, exercise, as well as having a good diet. Here is more of the details.
The Lions Club Kampala has organized several health camps in Kampala Metropolitan as part of its Diabetes Week commemoration. Friday evening, Lions Club members gathered at Sister Mariam Dungan Primary School in Kamocha to offer support to patients in need of basic help. The camp that offered free service with support from Lions Club International was boosted by the presence of medical experts from Christian Caring Center and Health 24 Lifeline International Hospital. A member of Lions Club of Kampala Central, Israel Manzi, explained that the Lions Club is facilitating diabetes awareness and prevention across the country through medical camps.
We've worked on about 600 people since morning. The turn-up has been high. We have actually been constrained by curfew and we are winding up, but there is a need. People are in need. These services have been free, courtesy of Lions Club's International Foundation, which catered for all the logistics required to run this camp, as you saw. And we appreciate all clubs in Uganda because various clubs are running this program of diabetes, testing people, making them aware of the disease, and this being an International Awareness Week, clubs all over the country are doing the same.
A volunteer with Lions Club International, Nalwoga Bajob, encourages youth to always go for checkups and eat well to avoid being affected by diseases.
You should always be active and mind the kinds of food you take. And if you dare take the foods that are actually so much high in calories and starch and stuff like that would bring about diabetes, you mind the quantity and quality you take. So that would help you in regulating the blood sugars.
Basigale nga bakolagana wamu ne Kamocha aba Lions tusigale okulaba nga tuyamba tusobola okulaba nga tuyamba ensi yaffe n'abantu awamu okumanya engeri gye balina okubeerawo n'obulwadde obwo, engeri gye balina okwekebezaamu n'okutambula awamu nga balamu.
Vincent Wamundu compiled this report.
One of the signs for diabetes, in case you don't know that you have it, is a constant dehydration and also sunken eyes and a sloppy skin. In case you know someone who has such signs, please ask them and guide them to go get a diabetic test so that we can have early diagnosis for better prevention. Otherwise, health is wealth. Away from that, into science and technology, we get to look at Makerere University having scooped the top position in artificial intelligence application competition code named Africa Artificial Intelligence and the Internet of Things Challenge Uganda. Kabale and Busitama universities were the first and second runner-ups in the undergraduate project.
Makerere University has won this year's graduate project for African Artificial Intelligence and the Internet of Things Challenge competition, with Kabale and Busitama University in second and third position. While for the startup projects, smart and affordable lithium battery emerged the winners, with early pest detection and COVID-19 SOPs adherence system in second and third position respectively.
So we kept on doing selections until we came up with 3 graduate projects of students who have just finished campus, and then 8 startup projects. Those have been assessed today, and the 3 graduate projects qualified to go to Dubai. The best is from Makerere University. The second best is from Kabale University, and the last one is from Busitama University. Those 3 are going.
We participated in this competition of Internet of Things and Artificial Intelligence, and we are really proud that we are the winners, and we have brought it back home again. Makerere University, we continue shining, and we are heading to Dubai for Africa and competitions.
And today we presented our technology at the African AI and IoT Challenge, and we're very happy that we were selected as winners in our category.
The Permanent Secretary Minister of ICT and National Guidance, Amina Zawede, officiated the event and highlighted on the importance of investing in artificial intelligence in curbing criminal activities.
But to hear that we have our very own Ugandans or people within this country trying to come up with solutions to address our own challenges implies that these solutions are indeed feasible, realistic, and we are sure will take the test of time, because we are now moving away from getting foreign solutions to solve our problems, but now having solutions that are homegrown. But there is more to that. We need systems that can be able to detect. We need systems that can be able to sense before the actual, incident happens. And the only way we can do that is through these fourth industrial revolution technologies that include artificial intelligence, that include use of robotics.
The African Artificial Intelligence and the Internet of Things Challenge competition winners are to represent Uganda at the continent level in Dubai towards the end of the year. They will have a chance to meet the world's richest men under the Institute of Electrical and Electrical Engineering.
Because here now, once you win here, then you are given an air ticket, full board accommodation, in Dubai for 4 days, and then you come back. But when in Dubai, you'll be given people who can talk to you, who can mentor you. You'll get exposed. There is a worldwide conference of Institute of Electrical and Electronics Engineers, what we call IEEE.
Sada Mubale, UBC News, Kampala.
Thank you so much, Saddam. We take a short commercial break. When we return on UBC Lunchtime News, we give you an update on our business news.
Grow together with one of Uganda's largest companies. Apply for MTN shares for as low as 100,000 Uganda shillings. And when you apply using MTN Mobile Money, you get 10 free extra shares for every 100 shares you apply for. Dial *165*65# or use the MyMTN app to apply now. The terms and conditions of the offer and other important information are set out in the prospectus. For assistance, visit any MTN service center or Stanbic Bank branch countrywide or a licensed broker.
It's the festive season and we love it. And that means it's time to celebrate with GoTV.
Come with me.
So get your GoCoder and GoTV value for 25,000 shillings to watch with the whole family. And if you're feeling extra festive, upgrade to our best package yet, GoTV Super.
Something to look forward to.
Download the My GoTV app for more information.
Super.
We all deserve a super festive season. And with GoTV, there's every reason to love it.
Introducing Learn From Home Data Bundles. Customized bundles for you and your family to study or work seamlessly from the comfort of your home. Use any of these affordable data bundles to connect to your MiFi routers, laptops, tablets, and smartphones while avoiding unwanted internet exposure and ensuring undivided attention during online classes. Enjoy instant access to Zoom, Microsoft Teams, Google Meet, and selected educational websites. Dial *175# to buy your Learn From Home bundle today. Airtel, the smartphone network. Terms and conditions apply.
It's no secret that ICT makes learning easy.
The strides made in our field couldn't be possible without it.
And now we can watch our favorite show.
My radio is my best friend.
UCC provides an enabling regulatory environment and policy guidance for healthy competition. We also facilitate ease of doing business in the communications sector through licensing, standardization, spectrum management, tariff regulation, rural communication development, and consumer empowerment. An informed consumer is an empowered consumer. UCC supports local content and innovations. Driving the development of a robust communication sector in Uganda is Uganda Communications Commission.
Introducing Learn from Home Data Bundles. Customized bundles for you and your family to study or work seamlessly from the comfort of your home. Use any of these affordable data bundles to connect to your MiFis, routers, laptops, tablets, and smartphones while avoiding unwanted internet exposure and ensuring undivided attention during online classes. Enjoy instant access to Zoom, Microsoft Teams, Google Meet, and selected educational websites. Dial *175# to buy your Learn from Home bundle today. Airtel, the smartphone network. Terms and conditions apply.
Welcome back from that short break. UBC Lunchtime News does continue. My name is Pricilla Nalwoga. Now, every one of you has been asking themselves why the fuel prices are spiking to the high. And the Ministry of Energy and Mineral Development has spoken out on what is causing the current fuel price spikes. This was at the press briefing at the Uganda Media Center, where the forthcoming Energy and Mineral Week running from the 23rd to the 26th of November 2021 was announced.
We can do little as a country because the oil producers, the price of oil internationally, crude oil, has gone up. You cannot escape it. And we don't have resources to say that let's subsidize the consumers. And if you considered our petroleum products and their prices in the region, Uganda remains still cheap in these oil products, the petroleum products. We are cheaper than our neighbors.
The other thing that is monitored by the government is to make sure that there is no shortage in the country. Now, we as government set what we call a reserve price. Reserve price is to ensure that our players do not overcharge you at the pump. Which means that as Uganda, much as is supply and demand driven, we ensure that our prices are low. As we speak, no one has exceeded the reserve price that we set as a country.
Well, we do have the commissioner there committing to you that there is a reserve price regardless of how high the prices are going. It's still catering to be within your pocket. Away from that, still in business, the Uganda Business and Technical Examination Board is celebrating 10 years of organizing technical vocation and business education examinations. According to the Executive Secretary, Onesmus Oyesije says there has been tremendous achievement in standardizing technical, vocational and business training assessments. You do have the UBTEB is also ready for the assessment of national certificate diploma examinations for technical and vocational education that are scheduled for the 13th of December all the way to the 22nd of December this very year.
The journey to streamline examination of technical and vocational education for the last 10 years has seen transformation in the skills assessment and enrollment in the country. The Executive Secretary, Uganda Business and Technical Examinations Board, Onesmus Oyesije, says that they are now able to examine over 100,000 students as opposed to the 20,000 students 10 years ago.
By the time we came into existence, every institution in Uganda was examining itself, assessing itself. So the marketplace became like a catalogue. You would not know who has studied for 1 week or who has studied for 1 year.
Onesmus Oyesije says that the examination board has organized a series of events to mark 10 years beginning on the 23rd of November 2021 to 25th of March next year.
The board has invited representatives of key stakeholders in accordance with COVID-19 guidelines issued by Minister of Health. The board has organized events to celebrate the 10 years, including regional meetings with the stakeholders and corporate social responsibility events across the country.
UBTEB has accordingly undergone a number of reforms in the last 10 years.
And these include tripartite assessment, whereby we work close with the industry or practitioners. We work close with training institutions so that we are all involved in this assessment. We have also put in a place, we no longer have people come and line here. Most of the work is computerized, and we do online registration of candidates. Submission of courseworks are done online. Certification of certificates is done online.
Government is revising the current TVET law, and to Onesmus, this is a welcome venture.
So the future of the board, of course, will follow the same policy guideline, which looks at the TVET training as a whole, not dividing it into those who are in the university. It's going to be a system on its own.
Meanwhile, the Examinations Board has released the Technical and Business for Certificate and Diploma Students Examinations Roadmap. These are to be done in 2 series, beginning on the 13th up to the 22nd of December 2021.
Diploma programs in technical programs, and these are mainly from technical colleges. That's one category. Those are their first years, actually, who should have done exams last year, but due to lockdown. Then the other category is from national certificate, but technical. National technical certificate programs from all the vocational and technical institutes, and this will be 1 year because the other year their colleagues did exams in March.
Well, Christmas is around the corner, and I'm pretty sure you've not been to some parts of Uganda. Of course, you do have the Uganda Tourism Board that is encouraging the locals to enjoy their very own part of Africa. Have you heard of a place called Wanale Hill being one of the most spectacular features in Mbale City, which is a new city? Well, if you want to access Wanale, there is some trekking through woods, climbing cliffs, crossing streams, and walking through the frosty forest before reaching Kauku Cave, which is the center of Wanale Hill. Now imagine that. Well, guess what? The Mountain Elgon Tourism Network is calling upon all Ugandans to visit Mbale City and also Wanale Hill and enjoy the spectacular beauty of our country. So that is something for you to look out for this Christmas. Anyway, do have yourselves a lovely afternoon until we meet again. Do get vaccinated also.